Good morning. Hope you're doing well today. Hey, we're finishing up chapter 12. This is part 2. We're looking at the exercise considerations. Here we go. Resistance exercise training is the key to gaining muscle. There are some key concepts associated with that. A lot of it depends upon your repetition, so the number of times you perform an exercise, as well as the intensity, which is determined by the weight lifted. And we typically calculate that depending upon your repetition maximum. So the 1 repetition maximum is a max weight that's lifted once. You also have the 8 RM, which is a max weight lifted exactly 8 times. And there are other variations of that. You can go 3 repetition maximum, 5 repetition maximum. Really depends upon what your goals are. So and your level of fitness as well. So training based upon the 1 RM, typically high intensity is considered to be 80 to 90% of your 1 RM. And typically you'll do about 1 to 5 reps. The idea is to build strength and power. Now, if you want more of a moderate intensity, you're going to go 60 to 80% of the 1 RM with 6 to 12 reps. And the idea there is that you're building muscle size. So looking at hypertrophy. And then low intensity is 40 to 60% of the 1 RM. And you're typically going to do about 12 to 20 or more repetitions, and you're building muscular endurance. So the primary purposes of resistance training, one of those purposes is strength development. And again, it's just to increase muscle strength. Really, the idea would be to lift more weight with fewer repetitions. So 3 to 5 sets of 1 to 6 reps with 80 to 90% of your 1 RM. For endurance development, you're going to enhance muscle endurance, and you're lifting less weight, but you're doing more repetitions. So you would do 3 to 5 sets of 12 to 20 or more repetitions with 40 to 60% of your 1 RM. And then there is a strength endurance continuum, if you will, that you can see in the image here. If your focus is for strength, of course you're going to do more weight, fewer reps, and more of a mixed focus where you're wanting both strength, power, and endurance. You're going to do a moderate weight and moderate repetitions at 6 to 12 reps. Whereas if your focus is on endurance, you're going to do less weight but more reps. And in summary, your approach to resistance training should align with your specific goals. For strength goals, focus on lifting heavier weights with fewer reps. For endurance, you use lighter weights and more reps. Understanding and applying that strength endurance continuum can help you to tailor your workouts to achieve optimal results. Now, as far as recommendations for resistance training for healthy young adults, you want to incorporate resistance training to improve muscular strength and endurance. So aim for 2 to 3 non-consecutive days per week and use a variety of exercises targeting major muscle groups. For the elderly, resistance training programs should be part of their routine to maintain and improve muscle mass, strength, and functional independence. Focus on lower intensity and higher repetitions. Safety and gradual progression are key. For those with cardiovascular disease, the American Heart Association recommends tailored resistance training programs, beginning with a low intensity exercise and gradually progressing under medical supervision. Now, ACSM, or American College of Sports Medicine, progression guidelines are to gradually increase an overload to maximize muscular size and strength. And it's suitable for bodybuilding or sports competitions. Follow a structured program with periodic reassessment and adjustment of training loads. In summary, resistance training is beneficial across different populations, from young adults to the elderly and even those with cardiovascular conditions. Tailoring the program to individual needs and gradually increasing the training load ensures safety and effectiveness. Remember, a well-rounded exercise program incorporates both aerobic and resistance training components. So some general guidelines for Resistance training for muscular hypertrophy specifically, you're going to go high volume and multiple sets. So you're going to emphasize 6 to 12 repetitions per set. Perform multiple sets for each muscle group to maximize muscle growth, and focus on moderate weights and higher volume to induce muscle hypertrophy. If you're training for strength and power, you're going to do multiple sets with fewer repetitions. So emphasize a range of 4 to 6 repetition set to build maximal strength, and incorporate multiple sets of light loads, 30 to 60% of 1 RM at a fast contraction velocity to enhance power. Combine heavy lifting with explosive movements for optimal strength and power development. So your training approach should align with your specific goals. For hypertrophy, focus on higher volume and moderate weight, while for strength and power, prioritize heavier weights with fewer repetitions and include some explosive exercises. So tailoring your program in this way will help you achieve your desired outcomes more effectively. So if we look at local muscular endurance, you're going to do multiple sets with light to moderate loads. Perform 15 or more repetitions of 40 to 60% of 1 RM or repetition maximum, and maintain a short recovery period between sets to keep the muscles under continuous strain. This approach enhances the muscle's ability to sustain prolonged activity and resist fatigue. Now, if you're just training for health-related benefits, single sets are efficient. You want to set weight to achieve 8 to 12 repetitions per set. Incorporate a variety of exercises targeting all major muscle groups. That method promotes overall health, muscular strength, and endurance with a time-efficient approach suitable for most individuals. So what are the basic principles of resistance training? One of those is the overload principle. This involves increasing the demands on your muscles to make them stronger. You can achieve this by adjusting 3 key variables: weight, repetitions, and sets. By progressively increasing these factors, your muscles are forced to adapt and grow stronger over time. The principle of progressive resistance exercise, or PRE, is emphasizing the importance of gradually increasing the overload. By systematically adding more weight or increasing repetitions and sets, you ensure continuous improvement and avoid plateaus in your training. Lastly, the principle of specificity highlights the need to concentrate on specific muscle groups relevant to your sport or fitness goals. By tailoring your exercises to target these specific areas, you can improve your performance and particular activities and achieve better results. By understanding and applying these principles, you can optimize your resistance training program for maximum effectiveness. If we look at the principle of exercise sequence, there are various approaches. One approach is to do more like a circuit, where you perform a set of 10 different exercises, then repeat the circuit. And you're moving quickly from machine to machine to try to get more of a cardio kind of response. Alternatively, you can do 3 consecutive sets of the same exercise before moving on to the next. As far as order of exercise, you should start with multiple joint exercises before moving on to single joint exercises. This means like deadlifts, squats, things like along that line, where you're using multiple joints rather than doing more of single joint exercises. You would do more single joint exercises with machines, like a bicep curl. And you always want to begin with the large muscle group exercises first. So again, more along the lines of a squat, where you're using quadriceps, hamstrings, and glutes versus bicep curls. You want to perform your higher intensity exercises before those of lower intensity. So those that require more power, the hang clean, power clean, those types of exercises before more of your bicep curls. And include both concentric, which is muscle shortening, like your bicep curl, and eccentric, which is more muscle lengthening. and would be more like a tricep extension in your program. So you want to include both of those. There's also the principle of recuperation or recovery, which is really rest between sets. So you rest for 2 to 3 minutes or more between consecutive sets of the same exercise, especially if you are working on, if you're doing a lot of weight. So if you're doing 3 to 5 repetitions, you're going to need a little bit more recovery in order to pull that again. As far as rest between workouts for beginners or those training for health benefits, you want to include a day between workouts. You may be a little sore the next day, and so you may want to look at doing different exercises. And the principle of periodization, so cycle training throughout the year. You have a microcycle, which is a short period, typically 1 week. And then you have a macro cycle, which is typically a year or more. And your mesocycles actually make up your microcycle. So you may have multiple microcycles within a mesocycle. And typically that spans for over several months. And you'll have a few of those within that macro cycle that would include some phases for tapering as well as in preparation for your competition. Now your macro cycle could be, we're all watching the Olympics now, it could be for 4 years. And so your cycling, your phases would differ based upon that cycle. So this is just an example of a resistance training program to help you to gain weight with lean muscle mass. Ideally, you should learn proper technique first. So ensure you know the correct form for each exercise. Really important that you either have a personal trainer help you in learning that. And I will tell you, I know many of you are planning on going kinesiology, and you may think you know exercises, but it's always good to have someone who can guide you with that, or a coach, strength coach. Determine your 8 repetition maximum. Again, you can do 3, 5, 8, 10, 12 repetition maximums. It's really dependent upon what your goals are. After 2 weeks of practice, find the weight you can lift 8 times with proper form for each exercise, and then keep a weekly record. Track your exercises, your sets, reps, and weights used, and set your intensity level based upon that 8RM or your repetition maximum testing that you do. As far as exercise sequence and recovery, perform 1 set of each exercise in sequence. Take short recovery periods between your sets, and then work your way up to doing 3 to 5 sets per exercise, training 3 days per week. Monday, Wednesday, Friday is always a good training period. And when you can complete 12 repetitions for an exercise, increase the weight so you can only do 8 repetitions. It's the principle of progressive overload. Continue that process as you get stronger. Make sure you do a warm-up always, and finish with some stretching and cool down exercises. And of course, complement your training with a balanced diet high in protein to support your muscle growth. Consistency and progression are key to gaining lean muscle mass. So ensure you're lifting with proper form and progressively overloading and maintaining a balanced diet. It's important to use safety precautions with resistance training. You want to learn to breathe properly. And so you exhale during the exertion phase, which is the lifting or pushing, and inhale during the relaxation phase, which is the lowering or releasing. You always want to make sure that you use spotters when you are lifting heavy, especially for things that are over the face or the chest, so like the bench press or the squat. You want to use safety equipment, so wear appropriate gear such as weightlifting belts and wrist wraps if you need them. Ensure your equipment is in good condition and properly adjusted, and always make sure that you do a warm-up. A general warm-up of light cardio, like the Airdyne, where you're using both legs as well as arms, followed by some specific warm-up sets to prepare your muscles and joints. So just take a lighter weight and do that for a few reps. Use proper technique. So focus on correct form and technique to target muscles effectively and reduce injury risk. Start with lighter weights to master form before progressing. And protect your lower back. Always engage your core muscles during lifts and avoid excessive arching of the lower back by maintaining a neutral spine. It's really important. A lot of times you'll see lifters arching their back before a bench press. Not a good move. You want to flatten that back, abs tight. Control the movement of weights both during lifting and lowering phases to avoid sudden stress on muscles and joints. It's really important to avoid excessive stress on the lower back by avoiding overarching. Excessive arching of the lower back during exercises like squats and deadlifts. You want to make sure that you're maintaining a neutral spine position and engaging your core to support your lower back. So you can see here in A with the bench press, you want to make sure that your butt is on the bench and then your abs are tight. Make sure it's a 5-point contact. So it's shoulders, your butt, and your feet on the floor. And then, of course, I'm assuming this is like a push press that they're planning on doing. Again, you want to make sure that the back is flat, abs are tight, and oh my goodness, that looks like a deadlift. So again, flatten the back out, and you may want to even look at doing having like a belt or something along that line. So you want to use proper form. Poor technique can exacerbate low back strain. Focus on proper alignment and technique for each exercise, such as keeping the back straight and avoiding rounding. Avoid heavy weights without support. And so lifting weights that are too heavy can lead to improper form and excessive strain. Use weights that allow you to perform exercises with good form and use a belt if needed for added support. You can modify exercises that stress the lower back. So some certain exercises, such as traditional deadlifts and bent over rows, can place stress on the lower back. Use alternative exercises that target similar muscle groups with less risk to the lower back, such as sumo deadlifts, where the legs are further apart to take off some of that stress on the lower back, or some supported rows, using a bench to help with that. Perform core strengthening exercise. So a weak core can contribute to low back stress. And so you want to incorporate exercises that strengthen the core, such as planks and leg raises, to provide better support for the lower back. And avoid twisting movements under load. So twisting while holding weights can place significant strain on the lower back. Keep movements controlled and avoid twisting motions with heavy loads. And focus on controlled movements. So jerky or controlled movements can lead to back injuries. You want to lower the weight slowly and control all phases of the exercise to reduce impact on the lower back. The body gains weight with resistance training. Much of that is due to anabolic or hormones that build and muscle protein synthesis. The mechanism is resistance training increases the secretion of those anabolic hormones, such as testosterone and growth hormone. This enhances muscle protein synthesis. And the result is that there's an increased muscle mass over time as muscle proteins are synthesized more rapidly than they are broken down. Now, there's also a downregulation of muscle protein breakdown. And so resistance training also reduces the activity of pathways that promote muscle protein breakdown. And it causes an enhanced muscle retention and growth due to reduced catabolism. There we go. And activation of satellite cells. So resistance exercise activates myogenic stem cells or satellite cells, which help repair and grow muscle fibers. This increases production of myosin, which is a key contractile protein, and growth factors that support muscle repair and growth. There's also DNA stimulation and protein synthesis. So training stimulates DNA in muscle nuclei, leading to increased RNA production. And with that, an enhanced protein synthesis as RNA guides the creation of new muscle proteins. And one other mechanism is the formation of new ribosomes. So there's upregulated cell signaling pathways increase the formation of ribosomes, which are essential for translating messenger RNA into muscle proteins. And basically, it's a more efficient muscle protein synthesis and growth process. So resistance training promotes weight gain through a complex interplay of hormonal changes, reduced protein breakdown, activation of muscle repair mechanisms, and enhanced protein synthesis. Here are some key components of skeletal muscle. So you have, of course, the muscle fiber itself, and it is made up of individual muscle cells, also known as myocytes, that make up the muscle. Each fiber is multinucleated and is surrounded by a plasma membrane called the sarcolemma. Now, you also have myofibrils. These are long thread-like structures within muscle fibers, and they are composed of repeating units called sarcomeres, which contain the contractile proteins actin and myosin, as you can see, number 4 and number 5. Now, the sarcomere is the basic contractile unit of muscle tissue, and it is bound by Z discs at both ends, which contain thick filaments of myosin and thin filaments of actin that interact to produce muscle contraction. The actin and myosin filaments, if we break that down, the actin, which are the thin filaments, contain tropomyosin and troponin proteins that regulate muscle contraction. Now, myosin, which are the thick filaments, contains heads that bind to actin to produce force. And then you have the sarcoplasmic reticulum, and it is a network of membranous channels that surround each myofibril. It stores and releases calcium ions, which are crucial for muscle contraction. And then the T tubules, which are transverse tubules. These are tube-like extensions of the sarcolemma that penetrate into the muscle fiber and conduct electrical impulses from the surface of the muscle fiber to the sarcoplasmic reticulum, facilitating that synchronized contraction. And then the endomysium. It is a connective tissue layer surrounding individual muscle fibers. It provides structural support and houses capillaries and nerves. And then the paramecium, what you see there in the middle of the image. The paramecium is connective tissue that surrounds bundles of muscle fibers, or fascicles. There we go. It supports and provides pathways for nerves and blood vessels. And then the epimysium. It is a dense connective tissue surrounding the entire muscle, and it protects and encases the muscle, connecting it to tendons. So if we look at weight gain with resistance training, these are the different mechanisms for that. You have muscle hypertrophy, which is an increase in muscle fiber size. And the idea, the theories behind that are that there's an increase in the size of the myofibril. So there's an enlargement of the contractile elements within the muscle fibers. There's also an increased number of myofibrils themselves. So more contractile units contribute to greater muscle strength and size. And increased connective tissue. So there's greater amount of connective tissue that supports and stabilizes those muscle fibers. And an increase in glycogen and water. So there's enhanced storage of energy, substrates, and water within the muscle, contributing to increased muscle volume. There's also muscle hyperplasia. Now, this is an increase in the number of muscle fibers. While the primary mechanism of muscle growth is hypertrophy, Muscle hyperplasia may also contribute to overall muscle mass in some cases. There's an increase in bone density. Resistance training can stimulate bone formation and improve bone mineral density, leading to stronger bones. So muscle hypertrophy and hyperplasia are key to gaining weight as lean muscle mass. Additionally, you've got improved bone density, which is a beneficial side effect of consistent resistance training. And so by understanding that, you can tailor your training and nutritional strategies to maximize muscle growth and overall health. So is there any one type of resistance training program that's more effective than others for gaining body weight? You have isometric training, which is muscle contraction against an immovable object. And really, there's not any movement that occurs. This would be in the case of a wall sit or a plank. Now with it, there is limited direct impact on muscle size as there's no movement or shortening of the muscle fibers, but it can improve muscle endurance and stabilization. Isotonic training, here muscle traction where the muscle changes length. It involves movement against a constant resistance. And you have different types here of concentric, which is a muscle shortening, like a bicep curl, where you are lifting a weight, and eccentric, where your muscle is lengthening and you are lowering the weight. And really, isotonic training is highly effective as it promotes muscle hypertrophy through both concentric and eccentric phases, which are crucial for muscle growth. With isokinetic training, this is a use of specialized machines where resistance adjusts to the force exerted, allowing muscle to shorten at a constant speed. As far as effectiveness for controlled high-speed movements and improving muscular strength, it is effective, but less common in traditional bodybuilding. It can be useful for rehabilitation purposes and for precise strength development. So isotonic training, which includes both concentric and eccentric phases, is generally considered to be the most effective for gaining body weight, as it directly promotes muscle hypertrophy through dynamic movements. Isometric training can complement other methods by improving muscle stability, while isokinetic training is more specialized and used primarily in rehabilitation or specific strength training contexts. So choose a method that aligns with your goals and complements your overall training regimen. If we look at equipment, free weights tends to be the go-to, and it includes dumbbells, barbells, kettlebells, and other portable weights. The benefits are that it allows for a wide range of exercises and movement patterns. It also enhances functional strength and stability and engages stabilizing muscles for better overall muscle development. Now, you also have resistance machines, and this would include Nautilus, Cybex, Hammer Strength, and others. Benefits to that are it provides controlled and guided movements, reducing the risk of injury, and it's ideal for targeting specific muscle groups, so isolating muscle groups, more of the single joint exercises with precise resistance. So it's very useful for beginners and those focusing on isolation exercises. Now, there have been some recent studies that indicate that various training methods and equipment can produce similar gains in muscle mass and strength, which means that whether you use free weights or machines, the effectiveness largely depends on the training program and consistency. As far as specific benefits, free weights are often preferred for functional strength and overall muscle engagement, while machines offer benefits for specific sports or rehabilitation by allowing more controlled and targeted muscle work. When we look at caloric expenditure and resistance training, exercise duration and caloric burn specifically, the typical workout breakdown, having a 1 hour workout. So approximately 15 minutes are spent actively exercising with resistance, while The remaining time is focused on recovery and rest. During active exercise, resistance training burns calories, but the overall amount is less compared to more of your aerobic or cardiovascular exercises. There is a metabolic after effect that occurs, and basically that refers to the calories burned post-exercise as the body returns to its resting state. Now, the resistance training impact of that metabolic after effect is relatively low. It's approximately 10 kcals burned over a 45-minute recovery period following resistance training. There are several contraindications to resistance training for individuals with specific health conditions. So one contraindication is hypertension, and this is the case in which the resting systolic blood pressure is greater than 140, or the resting diastolic blood pressure is greater than 90. And really, high blood pressure can be exacerbated by heavy lifting. So individuals with hypertension should use lighter weights and focus on higher repetitions and controlled breathing. And I would also recommend that they check their blood pressure before beginning their exercise program that day, and maybe do a little bit of cardio. Sometimes that can relax those blood vessels so that the blood pressure comes down before you begin some resistance exercises. Those with heart problems, so anything that's arrhythmia or other heart-related issues, resistance training can place stress on the cardiovascular system. So individuals with heart problems should consult their healthcare provider and may need to avoid high intensity or heavy lifting, maybe focusing more on muscular endurance, lightweight with a lot of repetitions. For those with an abdominal or inguinal hernia, heavy lifting can increase intra-abdominal pressure, potentially worsening a hernia. It is advisable to avoid exercises that strain the abdominal area and focus on low impact exercises. And low back problems, so chronic back pain, recent back injury, or spinal disorders. Certain resistance exercises can exacerbate low back issues, so focus on exercises that do not strain the lower back and really help to strengthen core. Do core strengthening type exercises, and always make sure to use proper form. And then carpal tunnel syndrome, it is a compression of the median nerve in the wrist causing pain and numbness. And exercises that involve gripping weights or repetitive wrist movements can aggravate carpal tunnel syndrome. Use supportive equipment and modify exercises to reduce strain on the wrists. The American Academy of Pediatrics concluded the following about properly designed and supervised resistance training for youth. Resistance training for youth should be designed and supervised by qualified, knowledgeable adults, and should consider the level of training, age, motor skill competency, and proficiency in technique. It should also focus on technique at an appropriate volume and in a safe and enjoyable environment. Resistance training by youth includes more movement patterns in addition to traditional adult-like weightlifting activites. Research and science supports youth participation in appropriately designed and supervised resistance training with a low risk of approximate injury. The idea would be to include more of muscular endurance type activities, low weight, and a lot of repetitions. So again, the American Academy of Pediatrics supports the benefits of properly designed and supervised resistance training for youth. So a few things that they have proposed is that there is a reduced risk of sports-related injuries. And so proper resistance training can help reduce the risk of injuries associated with sports and aid in rehabilitation from injuries. We want to try to integrate that into physical education. So resistance training can be effectively incorporated into elementary and secondary school physical education programs, providing a structured and beneficial physical activity. It is also important for the promotion of lifelong activity. Engaging in resistance training at a young age can foster a lifelong appreciation for physical activity and contribute to overall psychosocial health. And neurological adaptations. There are benefits to that with strength gains in youth from resistance training that are largely due to neurological adaptations rather than muscle hypertrophy. And that includes improved coordination and motor skills. And in some instances, you may need medical approval. So some medical conditions may require prior approval from a pediatrician before starting a resistance training program to ensure safety and appropriateness. Resistance training offers a range of health benefits that can enhance overall well-being and quality of life. A few of those advantages are cytokine regulation. So the benefit to that, it increases the secretion of beneficial cytokines and decreases harmful cytokines, contributing to improved immune function and reduced inflammation. There's also improved insulin sensitivity. So with enhanced insulin sensitivity, it helps in protecting against diabetes and managing blood sugar levels. There's also enhanced daily functionality. So, and a benefit to that, it improves the ability to perform activities of daily living, making everyday tasks easier and more efficient. There's also blood pressure management. It contributes to improvements in both systolic and diastolic blood pressures, aiding in cardiovascular health. And as we mentioned earlier, there is an increase in bone mineral density, which reduces the risk of osteoporosis and fractures. As far as core strength and back pain relief, it can strengthen deep trunk and core muscles, which can alleviate chronic low back pain and improve posture. And there is a reduced risk of falls by improving walking endurance, balance, stability, functional mobility, gait speed, and stair climbing ability. And if we look at aging and muscle mass, the benefit to resistance training is that it attenuates the rate and magnitude of muscle mass loss associated with aging, helping to maintain strength and functional capacity. And there is also a benefit of body satisfaction and social well-being. It enhances body satisfaction, our appearance evaluation, and reduces social physique anxiety, contributing to improved mental health and self-esteem. When we combine aerobic and resistance training into one program, it can be highly effective for improving overall fitness and health. So two popular approaches to integrating these exercises are with circuit weight training, where you are moving rapidly from one exercise to the next with minimal rest in between. The idea is that you are using lighter weights and higher repetitions, and you can go for a certain period of time, typically 30 seconds, 60 seconds, something along that line. But it's designed to improve cardiovascular endurance as well as muscular strength and can enhance our VO2 max, which is a measure of our aerobic capacity. It is effective for increasing upper body strength with the resistance at less than 60% of our one repetition maximum and for sessions that last less than 60 minutes. Really, it provides a cardiovascular workout while building muscle, and so it improves both strength and aerobic fitness simultaneously. Now, circuit aerobics alternate between resistance exercise and aerobic activities. So you're combining aerobic exercises such as jumping jacks, running in place with resistance exercises, such as squats, push-ups, and it offers multiple health and performance benefits, including improved cardiovascular fitness, muscle strength, and endurance. And there have been some national fitness chains that really, especially for Curves, is one that was developed as a 30-minute program for women that incorporates that concept. Now, it provides a comprehensive workout that targets multiple fitness components. It can be time efficient and effective for enhancing both aerobic and muscular fitness. So if you have interest in that and combining your aerobic and resistance training together, you want to set goals. So determine your primary fitness goals to tailor the balance between aerobic and resistance exercises. Allocate specific days or sessions for each type of exercise, or incorporate both in the same workout using circuit training methods. Include a mix of exercises to keep the program engaging and target different muscle groups and energy systems, and allow adequate recovery between sessions to prevent overtraining and ensure optimal performance. So combining these two types of training can help you achieve a well-rounded fitness regimen, enhancing both cardiovascular health and muscular strength, and can provide something a little bit different in your normal resistance training routine. Integrating both resistance and aerobic training into your fitness routine can offer comprehensive health benefits, as we just talked about, but balancing them is crucial to achieving your goals. So there has been some research regarding the impact of high intensity aerobic training, and some potential issues with that are high intensity and volume of aerobic training may negatively impact strength and power gains, and it can lead to overtraining, which may disrupt hormonal balance and neuromuscular adaptations. It may also create an ineffective motor learning environment if not properly balanced with resistance training. There are some catabolic effects. Excessive aerobic exercise can lead to a catabolic hormonal profile where muscle breakdown may outweigh muscle growth. Moderate intensity training is more of a balanced approach. So recent research indicates that moderate intensity aerobic training can coexist with resistance training without significantly compromising strength gains. A balanced approach can help enhance overall fitness while avoiding the pitfalls of overtraining. Now, as far as an optimal sequence, resistance training should be done first. You want to maximize lower body strength improvements. It's recommended to perform resistance training before aerobic exercises, or you can do like a combo where you're working, you're doing resistance training for lower body and then doing some aerobic work. This sequence ensures that strength and power gains are not diminished by fatigue from your aerobic activities. And so plan your workouts to include both aerobic and resistance training, ideally separating them by time of day, possibly do one in the morning, one in the afternoon, or days of the week. And keep aerobic training at a moderate intensity to avoid interference with your strength goals. Adjust the volume of aerobic exercise based on your specific strength and power objectives, and make sure to ensure adequate recovery between sessions to prevent overtraining and allow for muscle repair and growth. And tailor the balance between aerobic and resistance training based on your fitness goals, whether it's improving cardiovascular health, building muscle, or enhancing overall athletic performance. So combining resistance and aerobic training can be effective when approached thoughtfully, ensuring that both types of exercise complement rather than hinder each other. So some key concepts with our exercise training. A basic principle underlying resistance training program is the overload principle, which simply means the muscle should be stressed beyond its normal daily levels. You also have the progressive resistance, which is a basic principle of resistance training. For as you get stronger through the use of the overload principle, you must progressively increase the resistance. And to increase muscle mass and body weight, you should exercise near the strength end of the strength endurance continuum. And so your resistance training program should also exercise all major muscle groups in the body, not just the biceps and the quads, but overall for a good balance. You need a variety of methods and equipment that are available for resistance training. Your research suggests that there are equally effective as a means of gaining strength and muscle mass if the basic principles of resistance training are followed. So you can incorporate some machine weights into your free weights routine. And then your resistance training. It is generally regarded as a safe form of exercise, but it may be contraindicated in some individuals. For example, those with blood pressure and hernias, high blood pressure and hernias. Although resistance training programs may confer some significant health benefits, also recommended that you add an aerobic exercise program to help condition the cardiovascular system. And that is all that I have for you today. Hey, thank you for being with me the past few weeks. We've covered a lot of material, and I look forward to seeing you again in another class. Have a great day.